For our project, we analyzed Alana Hodge, a 23-year-old weightlifter going Cal State Fullerton. She initially injured herself during a clean and jerk movement 2 weeks before University Nationals. She complained of low back pain on her right side directly after failing to complete her last lift. She went to Nationals 2 weeks later anyway, where she PR'd, but also injured herself. She has a lot of knee instability during the catch and front squat of her clean. She manages to get it up, but you can see she also has some ankle eversion during the jerk portion. When she goes heavier, she fails to complete the lift, and her faults are even more severe. She has a large amount of valgus collapse during her catch and clean, and her ankle everts even more during her jerk portion. She cannot lift the weight completely. For the overhead squat on her FMS, it was pretty good to begin with. She was able to get all the way down, however her heels did come up a little bit. She also bounces out of the squat on her pre-rehab FMS, where she's much more controlled and slow on her post-rehab FMS. Her heels stay on the floor, and her foot doesn't turn out as much. From the frontal view, there are not too many differences, although you do see her feet turn out, as I said before, in the video on the left from her pre-rehab program. It was much better on her post-program. Her knees are much more stable. Since her squat was pretty good already, we don't see very many changes on the heel raised overhead squat. She still does have a little bit of posterior pelvic tilt at the bottom, which she could use more core activation exercises to fix going forward.
For the inline lunge, we see in her pre-FMS that she has some instability when performing the lunge. In addition, you can see that her feet are not in line in between the edges of the board as compared to her post-FMS. You can still see some trunk movement in her post-FMS. But as I mentioned, her post-FMS, her feet are a little more in line in the middle of that board as compared to pre-FMS. In the sagittal view, you really do not see a difference between pre and post-FMS. In the pre, you do see much more of a heel raise of her back foot, however, compared to her post-FMS. When switching sides, again, no difference between pre and post. You still see some heel raise on that back foot. The hurdle step is where we saw the most improvement of all the FMS tests. As you can see in the post test, you have movement in the torso, movement in the hips, in which she hangs off the IT band, not being very comfortable standing on that one leg while moving the other leg. As compared to the post test, you definitely see a lot more comfort and control standing on that single leg while moving the other leg. In addition, on the pre-test, you can see some inversion and movement at the ankle when trying to step over the hurdle. Do not see that on the post-test. In the frontal view, the ankle movement is much more evident. You can see there's inversion of both ankles. You can also see that the leg itself isn't completely in line with the sagittal plane while stepping over the hurdle. The post-test shows that there is little to no movement at the ankle trying to step over the hurdle. And similarly to the frontal view, there's less movement of the torso and less movement of the hips in the post-test, where she doesn't hang off the IT band.
In the leg raise in the pre-program, it was seen that actually both legs were shaky, the stabilizing leg and the active leg when it was raising up, as well as the bottom leg or the stabilizing foot turning out. In the post-program FMS test, both legs became more stable, so the active leg in raising up, as well as the bottom or the stabilizing leg became more stable as well, and there was less foot turnout seen. So it can be shown that her core increased stability when raising one leg up while the other leg was stabilizing at the bottom, so when her hips were in different positions. The sagittal view was not shown here because there was no difference. In her training program, we included Pallof press to focus on core anti-rotation, and she performed this in a split stance because this is functional and specific for her weightlifting sport. She will be forced to prevent her core from rotating in this stance, and that was an issue for her in general with her pain during rotational or split stance, split jerk activities. We also included overhead press in a split stance as well, forcing her to use more of her core and the stabilizing muscles compared to her lower back overextending when pressing overhead. The split stance will force her to become more stable with this movement or with this overhead press compared to just standing.
Okay, this is a variation of a lunge called an offset lunge. The weight is put in the contralateral arm and gives a lateral flexion effect, so she has to resist against lateral flexion. This is the side that's injured, so she has a harder time with the right leg coming forward than the left leg, as you can see in this rep right here. A lot easier. So this is one of the ways to strength train, even with strength train lateral flexion in a way that's a little more specific to her sport. And this right here is one leg RDL. We regressed her and started her off by having her hold on to something as she did it, just to get the position down and the balance right, and then we put a weight in her ipsilateral hand, and then this right here is contralateral. It's fairly heavy weight for her, so she still has a little bit of some balance issues to work on with this, but it was definitely improvement. We started when it was just body weight. She had a hard time doing movement in general, so she's gotten a lot better at this. Okay. This is further along, and this is 2 reps of power clean with a fairly heavy weight for her. That first rep, you can see she had a good amount of stability in her knee. The second rep, she still loses a little bit of stability, but it's definitely an improvement. Here it is again. So you can see the difference from the first rep to the second rep. So the first one looks good, the second one she loses stability just a little bit. Okay. This is a regressed version of the split jerk. What it is a pause jerk, so they pause, or she's pausing in the bottom of the dip portion right there, and then she pauses in the catch. This is to make sure that every time she does a jerk that she catches it in a stable position. This is a way she actually can correct anything going on in her hip. Right here is what's called a technique primer. This is what we added to the program before she did any kind of jerk work. She did this for several sets before. What a technique primer is, it's a couple exercises put together to work on one thing, and the thing we're working with her is stability with that right knee. So she's first doing an overhead press in the split position, and then now she's doing a jump into split. So as you can see, that right knee looks pretty stable. We do this every time before she puts more weight on the bar. And then right here she's doing a behind the neck jerk. Okay, and these are the most recent videos of her doing jerks. This one right here on the left is actually a new personal record for her. It's 78 kilos, whereas before, the videos at the beginning of this video, the most she had done was 76. That's where we saw a lot of instability. So she still has a little bit of instability, but it's a lot less of a rotational issue. Then this is the new one. This is her attempting for 80 kilos. And before, normally as she'd fail, she would fall over to the left with that right knee caving in. This time it just fell forward. So let's take a look at those two again. So again, the one on the left is a new PR. You can see, especially if you look at the foot, there's not too much of her crossing over to the left. So that's definitely a big improvement. And this one over here, it's good for us to see that she's not letting that right knee cave in and not letting her balance fall too far to the left. So that's a much more stable position, just still the weight's a little heavy for her. That is all.